Welcome back. You're watching The Globe here on SABC News Channel. Now, Malawi's health system is facing severe shortages of a local anesthetic called Lipato. The anesthetic is commonly used in labor wards. Medical practitioners say pregnant women have had to go through some important medical procedures without the drug. Keith Lipato is the public secretary for the Association of Malawian Midwives. He says the shortage is being reported by practitioners countrywide. The government has blamed the coronavirus pandemic for the drug import challenges, but it has assured the public that supplies will be arriving in the country. The shortage has resulted in an increase in home deliveries. This in a country with a high maternal mortality rate. So we speak now to Keith Lipato, as we mentioned, the publicity secretary for the Association of Malawian Midwives, otherwise known as Mami. He joins us from Mulanje in Malawi. A very good evening to you, Keith. Thank you so much for speaking to us. Obviously, it sounds like a dangerous situation. How long has it persisted, and any hope of the situation changing anytime soon?
Right, so thank you very much. As you rightly said, lignocaine, also known as lidocaine, is one of the anesthetic drug. So we, as an association for Malawian midwives, concerns from our members who are spread all over the country that the drug was not available in most of the hospitals in Malawi. Our main concern is that when women are giving birth, there are times whereby the baby would actually cause tears on the mother's birth canal, or sometimes when we see that the baby appears to be bigger than the passage, then we would initiate a deliberate cutting, which we call an episiotomy. Now, it's been very challenging for us to be assisting women suturing the episiotomy or suturing the tear without giving anesthesia. The reason why we have to give anesthesia is to make sure that the woman doesn't feel pain, say when we are cutting the episiotomy or when we are suturing the episiotomy. So the situation hasn't been very good since November last year.
So are there other medicines of which you're experiencing stock out? Because I've read in some reports that doctors are complaining about lack of access to thiopentone, which I believe is used if women are convulsing during labor or they're hypertensive.
Yes, so there have been quite a number of medicines and other supplies, as you've rightly pointed out. But as midwives, we were really very much concerned with the absence or the short supply of lignocaine. But there are some other essential medicines that are also in short supply.
I mentioned thiopentone because, I mean, we mentioned in our introduction about a country that has a higher mortality rate. Now, I'd imagine with situations like this, that the maternal mortality rate could be spiked as a result of this. If a woman is hypertensive during labor, I mean, that's a very dangerous condition. And neonatal deaths, I'm sure that's something that you would have to encounter because of these drug stockouts.
Yes, definitely. That would be some of the negative outcomes that would actually experience. As you've rightly said, our maternal mortality rate is on the higher side, and equally so, the neonatal mortality rate is also not very good. But then I would also want to, I would be very quick to point out that after we had raised the alarm, the Ministry of Health was very quick to respond. Just yesterday, we had a very productive meeting with the Minister of Health, Honorable Kumbize Kaponda, Chiponda, and present in that meeting were officers from the country's Central Medical Stores Trust, as well as officers from the Ministry of Health.
So this quick response, can you tell us exactly what is being promised? Because I believe that the Central Medical Stores itself owes medical suppliers in the region of 19 billion rand kwacha. How long has this been the case, and are you confident that enough funding would be procured in order to be able to buy supply?
Yes. In fact, we learned from the minister as well as from the Central Medical Stores that some express funding has already been given to the Central Medical Stores Trust, and they've acquired some essential drugs, medicines, including lignocaine, such that they promised us that delivery to all the hospitals would start today. And within a week, we should have supplies in most, if not all, the hospitals. As you did allude to in your introduction, one of the challenges that the ministry faced was the COVID-19, which affected the ordering, or rather the shipment of the drugs into the country. So we are very confident after yesterday's meeting that indeed the situation will improve. In the next day or two, we will be getting back to our members across the country to monitor how the situation is on the ground after the meeting with the minister. But we are very hopeful that the situation will improve positively.
Is it just the interruption in the supply chain of medicines as a result of COVID-19 that is a problem, or is it also a management issue? I ask this because I understand that the same Central Medicine Stores has about 2 billion kwacha worth of out-of-date medication. So this speaks to mismanagement to me.
Okay, well, so as a midwifery association, we wouldn't really comment much on that. I think maybe they themselves, the Central Medical Trust, would be in a better position to divulge more information, to confirm or not to confirm on that one.
I'm not trying to be pessimistic, but I am just wondering just how deep is the problem. So government says it's doing all it can to make sure that medicines and medical supplies to medical facilities does happen, and that it's speeding that up. You expect that to change in the next day or two. But what has been the result of the situation? Some reports are saying that private institutions are mushrooming as a result of the stockouts, and it's led to people having to go to these instead of public hospitals, where we're told that district hospitals have had to shut down their theatre operation rooms.
Well, yeah, I mean, obviously, if women go to a government hospital and they're told there's no lignocaine and there's a private hospital nearby, I mean, yes, they would go to that private hospital. And the unfortunate thing would be that maybe the fees at the private hospital would be much, much higher, whereas at the government hospital, the services are mostly free.
No, I understand the law of capitalism, if it were, or business as supply and demand. But would you say then, as a result, that private institutions are benefiting from the shortage of medication in public institutions?
Yeah, that is likely to happen, and that is happening.
So we hear from the Society of Medical Doctors in Malawi that the shortage of anesthetics is just the tip of the iceberg. Share with me, from a general health system perspective, what staff are experiencing, because some of the reports suggest that there is a shortage of trained or qualified individuals at public institutions, bad working conditions, lack of equipment. Are you able to speak to some of this?
Okay, so generally, I would say that the system is operating quite well, and we are managing some of these challenges. Yes, we have shortages of staff, but government is trying to employ as many as they can within the national budget, but we still have some staff shortages, I would say so.
I mean, shortage of staff, shortage of equipment, again, that speaks to a money issue. Reports say that the health budget in Malawi, the 2021-2022 budget, has been cut by 25%. Are you not concerned that this could become a perennial problem?
Yes, we are concerned. I mean, if you remember, the Abuja Declaration actually suggests that at least 15% of the national budget should actually go to health. And for us, it's about 9% as of this year's budget. So that's a concern to health workers and midwives in particular.
Well, thank you so much for your time. Much appreciated. Keith Lipato, he is the Public Secretary for the Association of Malawian Midwives.